Hello, everyone. Welcome to today's seminar. My name is Abdul Kadri, and I am your moderator for today's seminar. So today's seminar will be presented by Dr. Tibor, who is an assistant professor at the Department of Family Medicine, and he's a holder of Canadian Research Chair in Biostatistical Methods for Primary Healthcare Research. His main methodological interests are in the development of causal inference methods and their application in modern machine learning. In today's seminar, Dr. Tibor will illustrate how asking the right questions can prevent us from falling for bogus associations, kindly presented by increasingly available machine learning tools. So he's advocating for participatory approaches to spot obvious fallacies and coarse machine learning discoveries entail. So I think I should have started with the land acknowledgement, which I almost forgot, but it's better late than never. So McGill University is on a land which has long served as a site of meeting and exchange among indigenous people. We acknowledge and thank the diverse indigenous people whose presence marks this territory on which people of the world now gather. So today's seminar, basically, we will have the presentation by Dr. Tibor will be for 30 minutes, and then we will have 25 minutes for discussions. So you can all post your questions in the discussion forum as he's presenting, or if you have any question, you can raise your hand during the discussion section, and then we'll call upon your name for you to ask your question. So without further ado, we'll call upon Dr. Tibor to give us the presentation. Dr. Tibor, the floor is now yours.
Thank you very much, Abdul. And I also want to introduce Abdul, actually, because he hasn't done so. It's one of our new PhD students. He joined us in the winter. So welcome, Abdul. Thank you for doing this. And Abdul is being supervised by Dr. Elaine Adams and myself. So I will share my screen with you. I hope you can all see, and then we go right ahead. So let me just move this around here. Okay, so the title of my talk is Towards Participatory Data Science, why asking what is not enough. And now you may wonder, that is a bit strange. Tibor is actually a biostatistician. What is he talking about participatory research? So I will obviously demystify this little mystery throughout my talk. And I was thinking, actually, I should have chosen another title, and it would have been rather something like that. So this talk is really a call for developing participatory methods that will empower data science to be more inclusive. And why we need that, I will show you with the next couple of slides in my presentation. I do have no conflicts of interest to declare, just as a formal statement. So what's the outline of my talk today? So I will touch on two main quantitative domains in science. One is data science, and the other one is causal inference. And what I'm trying to do is to show you how participatory methods, and particularly involving human beings in research, can help to build a solid bridge between this rapidly emerging domain of data science and a long-standing but also rapidly evolving domain of causal inference. And before I do so with concrete background, definitions, and also examples, I want to give you a little quotation from a famous causal inference researcher. So Judea Pearl, he's a pioneer on causal inference. He said once, he doesn't understand why everyone talks about data science. There's a data science department in every university. There's the Journal of Data Science. He said, it shouldn't be named data science. It should be named reality science, because we use data to make inference about reality, to learn about the causal underlying laws that determine our daily lives. So I want to keep this in mind, and that's why I keep these two domains in my talk separate. Some individuals may say, causal inference, it's within data science, but we will see. And yeah, what else to say? Data science, that's a scary topic. It's 2021, and I think there's no way we're not getting exposed to some of those buzzwords, to fancy technologies, to stunning headlines claiming that data science is taking over. And I think many of us feel left behind. They may feel illiterate, they may feel not empowered to embrace these changes. Because it's a very technical domain. It's very mathematical, it has to do with computers, with programming, algorithmic. So this is a field that is taking over, where less and less people feel comfort and feel safe. So what I want to say is, first of all, don't feel intimidated. There's opportunities for you to take part of this change. And this is part of my talk, or the mission of my talk, to show you that regardless of your level of education, your level of training in statistics and data science, you will have a say. And that's why I start with the conclusion first, which is a bit funny maybe. So last things first. There's this Latin phrase saying sapere aude, which is translated, usually it's translated to dare to know. I like a more sophisticated translation, which means have the courage to use your own reasoning. And this is really the guide that should accompany you in your future research and in any future discussions that relate topics that may touch on data science, on technologies you may not fully understand. But dare to know and dare to use your own comprehension, and you will be able to make a contribution and to critically appraise what is being presented. And again, with this talk, I try to stimulate a bit of discussion, at least, on how can we do that? How can we bring in more of our human intelligence in this whole data science endeavor? Okay, so now I think we should start with a couple of definitions, because I've been talking about data science. But what is data science actually? What does it mean? So now I've been a bit lazy, so I just typed it in Google, and Wikipedia showed up, and there's a definition. Let's use this definition, and I make it clear here. This is one of many definitions of data science. So data science is an interdisciplinary field that uses scientific method, processes, algorithms, and systems to extract knowledge and insights from noisy, structured and unstructured data, and apply knowledge and actionable insights from data across a broad range of application domains. This is the definition according to Wikipedia. So now, when I read this, I was actually half surprised, half pleased, because I saw an important term here that relates directly to causal inference: actionable. Actionable means causation. That means we want to intervene. We want to develop policies. We want to drive change. Now, this is really important to keep in mind, because you all may remember from your undergraduate or even high school training, correlation is not causation. So statistical methods, traditionally speaking, data science in a traditional sense, has always taken a bit of a distance to causal claims, right? We say, oh, that's an association. We do an associational study. Only in randomized controlled trials, the term causality, cause and effect, may appear in the conclusion or in the interpretation of the findings. But generally speaking, when we do research, we are quite aware of the limitations, at least in quantitative science, we are quite aware of the limitations of associational statistics and data science. Now, but this is a bit the paradox, and it's not only a paradox with a Wikipedia definition of data science, it's a paradox itself in science, in quantitative science. Because yes, we do use quantitative methods to inform policies. We use quantitative methods to build interventions, to appraise interventions. So there is a kind of a dichotomy. From a theoretical point of view, we are all aware that there's limitations to causation. And yet we use those research findings very often to inform policies. So now that brings us to the next level, where we say, okay, if it's not data science, if you talk about causality, what does that even mean? Okay. Again, I use a world famous search engine, thank you, by the way, data science, and I type in my definition, because I've been working in causal inference for a long time, and I never had to write it down actually. What is causal inference? So okay, I type it just in here. And now I keep this screenshot because this is already part of the problem here. And maybe one of the most striking examples that you will keep in mind from this talk. If you can see, there is about 5 point, oh my God, it's even more than 5 million, 5.1 million, says the statistician, results when I type in causal inference. 5.1 million hits for causal inference. Okay, that's a lot of options. It's a lot of options to zoom in and to find out what's the definition of causal inference. However, data science, so-called machine learning, has developed algorithms and is now suggesting me the two most useful definitions of causal inference. So already here, we're taking part of data science, the convenience of typing something in a search engine and getting the likely most useful definitions. That's what we take advantage of. Okay, so let's do this. Let's zoom in and read those definitions. And I know it's a bit dry now, but we will continue and we'll see a bit more examples then more concretely. So the first definition is causal inference refers to an intellectual discipline that considers the assumptions, study designs, and estimation strategies that allow researchers to draw causal conclusions based on data. So that's a definition from a website, Science Direct. I don't know why it was suggested. Okay. Well, when I read this, I was a bit surprised. I say intellectual discipline. I've never heard that phrase. It seems a bit elitary, a bit like, okay, you're going to be particularly smart to be part of this. Maybe not. Maybe academia is considered intellectual at all, I hope. But I wouldn't necessarily agree with the intellectual part. But what is more concerning is there's something missing. Causal inference does not and cannot draw alone on data. Causal inference always requires external information. So from this perspective, this definition is not correct. I will allude more on this, why external information, what it means. And in fact, you will see that this external information is exactly the part where participatory methods come in, where human intelligence, experience, knowledge come into making inferences. Okay, we have a second chance here. We have another definition. Our best friend Wikipedia is helping us out. According to Wikipedia, causal inference is the process. Oh, sorry, let me go down. Is the process of determining the independent actual effect of a particular phenomenon that is a component of a larger system. So I was reading this carefully many times and I couldn't understand. And I must say I give Wikipedia an F here because this is not a definition of causal inference. There's important things missing. First of all, an effect cannot be absolute. There is no the effect of a vaccine. There's an effect of a vaccine on something, on getting the virus, on getting sick, on getting hospitalized. But there is not just a generic effect. And there's not only one effect, there's multiple effects. So what I would have said is, I would have rephrased the definition here and saying, causal inference is the process of determining the independent actual direct and indirect effects of a particular phenomenon on another phenomenon within a larger system of phenomena. So again, very abstract, but the key message here is we rely on data science, on algorithms that help us out, that are convenient, but we're going to be very careful if we take those findings and operate on their behalf. So in this case, definition of causal inference didn't go too well, but I hope I can help you to understand more what causal inference is about in the next couple of slides. Oh yeah, well, more definitions. Sorry about that. It's really complex. So we have talked about data science, and I already mentioned the term machine learning. And I want to just put up here two definitions to better understand and zoom in. So within the entire domain of artificial intelligence / data science, there is a subdomain called machine learning. And machine learning basically is a subset of artificial intelligence that uses algorithms to learn from and make predictions about data without being explicitly programmed. So machine learning, I will use this term in the next couple of slides. It's a subfield in data science. Data science is very big. And artificial intelligence is even bigger than data science. It can go beyond data. It's about emulating human behavior, intelligent behavior. So these definitions are in place, but there's, again, multiple versions, multiple definitions available. I will use these definitions as my working definitions. Okay, so now let's really look a little bit, zoom in and understand why do we need to be maybe concerned, or at least be aware of limitations about what data science has to offer. Because again, from a statistical, from a philosophical point of view even, data science in its traditional sense draws on associations. So data science has made huge progresses in pattern recognition, for instance. And I use an example here. I have a soccer ball. So data science can be used to very nicely describe what's the shape, what's the colors, what are the sections, how do they interrelate in that specific pattern. So pattern recognition is a huge field in machine learning, and it's used to describe conditions, static conditions. And it can help us to identify certain issues. For instance, what does the presence of a certain feature A tells us about another feature B? For instance, what tells us the presence of a lesion on an X-ray about the presence of cancer? So this is, we call this so-called joint distributions. The presence of one may imply the presence of another. And that's what we have been doing. Even in radiology, it's a long-standing tradition, looking at X-rays and trying to ascertain the presence or absence of a certain condition, given the image we have. Now, to find an analogy here with what we are interested in, causality or causal inference, is not just to describe patterns under static conditions, but to understand patterns under changing conditions. So we are really interested in, okay, how is the soccer ball held together? What are the underlying laws? What's the tissue, the air, the inflation? So we want to understand how can that soccer ball be inflated or deflated. So really, causal inference is about the understanding of the dynamics of patterns and events under changing conditions. In these changing conditions, we often refer to them as counterfactual conditions, because these are conditions that are not there yet. These are wishes, like dreams, ideas, future policies, where we say, what would happen if you would do that? What would happen if I sit on that ball? Will it bend? Will it stay? And it's the same with many other applications of data science. We may have observed data, but we want to understand, what is if I do something to the bit? What is if I prescribe vaccination? What if I give this pill? What is if I do this health education? So really, what we need to know is, how do things change? Not just how are things. So, and that's already partially the answer to the title of the talk. So, is questioning what is really enough or not? So I will give a concrete example here, because we are still in a pandemic and vaccinations are rolling out, and we need to understand what's the efficacy, what's the utility of different programs, different interventions. We had masks, we had lockdowns, now we have vaccines. So from an observational point of view, we may see our total population, we can divide into vaccinated, non-vaccinated individuals. And then we can, at the same time, measure, okay, the presence, incidence even of the disease. So now we will see on the left-hand side, we can clearly see, okay, it seems like that even though there's less people not vaccinated, there seems to be a higher frequency of the disease. And that's what we would expect from a vaccine. However, this statement is really just looking at what is. It's a joint distribution. Vaccination status, yes, no, versus disease, yes, no. It's a joint, it's a snapshot at a moment of time. In a counterfactual setting, and that is the question we should perhaps really ask is, we would like to compare two counterfactual worlds, two competing worlds. So what we would like to know is actually, what is the disease distribution is if everyone would be vaccinated, and it's the blue circle, versus what would be the disease distribution if nobody was vaccinated. So this is the true causal contrast, because we will include everyone and assign them two possible states, vaccinated and not. Similar sometimes in studies where, let's say the exposure of smoking, okay? If we're interested in the effect of smoking on lung cancer, the comparison of two worlds where we say everyone would be smoking versus no one was smoking, it wouldn't make sense, because we would force non-smokers to become smokers. That's not really our interest. Sometimes we're only interested in the effect among the exposed. So in a smoking study, for instance, we might be interested in looking at, okay, among those who smoke, what would happen if they would not smoke? So we want to have the exact mirror image. That means keeping all characteristics of those individuals constant by only changing the exposure status. So why is this important? Why can we not hold on observations alone? Why do we need to employ methods that allow these causal inference? Because we want to make interventions. We want to act on those effects we see in populations. So the questions we really want to ask is, what if all smokers would not smoke? What would be the finding? What if the entire population was vaccinated versus the entire population was not? And there's two directions of those proper questions we can ask. We can project into the future, and that's what typically happens in many research studies that try to establish effectiveness and safety of interventions. If we do a randomized controlled trial, for instance, we want to establish causal effect, and we want to get an idea, especially in effectiveness studies. What if we would treat everyone with treatment A versus B? So that is a projection in the future. Sometimes we want to go back in time, and in retrospective studies, for instance, that's an application here. Sometimes we want to understand, why did someone acquire disease? Why did an individual acquire a certain health? So questions of why and what if are both causal questions. And that's the real question we need to ask. Snapshot at a time, descriptive statistics and comparing proportions, it has very limited utility in drawing causal conclusions. Maybe I can give one more example on the left graph. In the 1950s, there were first reports that indicated that non-smokers had actually lower lung cancer rates than smokers. It was just a graph like that. We had smokers and non-smokers, and there were differences in disease incidence or disease prevalence among those groups. Now the tobacco industry responded and said, okay, so you are saying that non-smokers have a lower lung cancer rate. That's interesting, because almost everyone is smoking. So the non-smokers must be really some weird people. Like, they don't smoke, they have some complete different lifestyle. Who knows what they are doing? So there was an argument made saying, okay, there's something unusual between smokers and non-smokers, among non-smokers compared to smokers. And I think that's what we need to keep in mind. Even though we have population level data in hand, there are characteristics sometimes that determine exposure status. Sometimes it's contradictions, sometimes it's contraindications, sometimes it's just different lifestyles. And that's confounding, basically. So we need to account for that. In a counterfactual setting, confounding is taken care of because we take the same individuals. I mean, all confounding factors are the same, and just expose them, not expose them, and measure the outcome. How we do this, that's a different question. There's methods developed that can do that, and that's one of the big advancements of these days. Okay, I want to just also show you that it's not things I make up here, even though I'm very enthusiastic about this. Again, Judea Pearl is one of the causal inference pioneers, and he just tweeted not too long ago, maybe a few months ago. I will add a reference on that. But he basically said, well, machine learning enthusiasts will be interested in George Lawton's new post titled Causal Deep Learning Teaches AI to Ask Why. Okay, so she's basically promoting another research group or researcher who proposes an AI algorithm that actually starts asking the right question, not just what is, but why. And now he admits, he said, I'm not familiar with all the actors mentioned in the story, but I'm glad that machine learning is moving beyond curve fitting. So curve fitting for Perl, that's what machine learning really is. It's trying to find a statistical model that describes, really just describes complex data. It can be a complex pattern curve, could be beautiful to characterize that curve, but it's really just description. So I recommend you a book Judea Perl has written for non-scientists, but also for scientists, obviously. It's the book of Why. And in this book, he really makes a strong case about why we need to ask why and not just what. Okay, let's look a bit more into the clinical context here and some concrete examples. So what does this all mean? Like causation and counterfactuals and why. So let's have a look at some very common, perhaps common questions we may ask in our daily research life. How effective is a given treatment in preventing a disease? What's the annual healthcare cost attributed to obesity? Can health records provide proof for sex or race discrimination? So these are words we use in our everyday language. We use it in research. We even use it in our, when we, I come home, have a cough. My mom tells me, you see, had you worn that jacket yesterday, you would have prevented to get sick. So we use this notion all the time of preventing, attributing, discriminating. But you would be surprised, even though it's so common and so intuitive, until very recently, and I'm talking about within the last 30 years, 30, 40 years, not more, we had no formal framework to articulate these causal mechanisms. And I will explain you why. Because in data science, what we have been doing and what machine learning is continued to do, we have used mathematical equations to describe the relationship of things, the association of things. Now, equations, the word equation comes from equality sign. It has an equality sign there. So an equation is a symmetric object, a symmetric mathematical object. So I give you an example here. We know that certain diseases cause specific symptoms. So we could mathematically describe symptoms as a function of the disease. Now, according to this equation, we would be allowed mathematically to rearrange that expression and say, oh, well, if we can predict symptoms from a disease, we may also find out what determines the disease. So basically, by rearranging the equation, we would say the disease is a function of the symptoms. That might be true in an observational setting, saying, okay, individuals with certain symptoms may have a specific disease, but it's not, symptoms are not causing the disease. It's a directional relationship in one direction. The same way as rain causes mud, and mud is not causing the rain. And the temperature causes the thermometer to fall or to rise, and not the other way around. So there's a very simple notational trick here to introduce an arrow instead of equal sign. But of course, the inference, the statistical machinery behind is a bit more complex. And but it has been developed, and there's a framework available to allow now to appreciate those directional relationships. Okay, so now I invite you now to a little tour. Just a couple of examples, because I think examples are important, and I'm aware of time. I have another 15 minutes, so we will definitely get to cover those examples. And I just want to stimulate a little bit what can go wrong, and what do we need to take care or attention of, and also what could be the role of a participatory approach to prevent such I call this bogus associations. I've tried to use other words like spurious associations. There's always these very delicate words we use, very technical, but I don't think people get it. It's bogus. So that's why I will show you a couple of examples that will help you to hopefully understand the limits of machine learning. Okay, so here's what happened. This is my new laptop. I just got it in downtown the other day, late summer deal. I bought it and I was really happy, but it was like a last in stock kind of product. So they didn't have a proper case, and I like to carry my laptop case. So what I did is I went home and just ordered a nice matching laptop case for my laptop. Thank you, online shopping. So that's really appreciated. These days we can get what we want. So 2 days later, what happened? I'm sitting on my computer preparing this talk. Guess what? I'm getting advertisement about buying a laptop. I was talking to my friends. They're like, "Oh, this is so frustrating. I already have a laptop. Why do I get this advertisement? I just couldn't get it. I just didn't connect the dots." And then she said, "Well, people who buy laptops online may also frequently buy magic cases. So probably there was some algorithm that saw that you ordered a laptop case and it suggested to buy a laptop." So now there's a couple of messages in this little story. First of all, machine learning algorithms that are used for marketing are not necessarily using causal inference because they reverse the direction. Of course, if I have bought a laptop, I would like to buy a laptop case. That makes sense. If I would order a laptop and machine learning suggests me to buy a specific laptop case, that would completely make sense. But it's the other way around. I bought a laptop case. I mean, who starts buying a laptop case and then buys the laptop, unless they really know if they're going to buy the laptop? So that didn't make sense, and that's exactly the problem of directionality, which didn't apply here. The other lesson we learn here is I did not even connect the dots again, but my friend did, and she's not a statistician. She works somewhere, but this is what human reasoning can help us to identify. There's a clear connection. I mean, it's obvious that laptop case and laptops go together. So again, perhaps this is a moment where participatory, even it was not explicit requested, helped me to understand the issue. Let's allude a bit more on this temporality issue and why the directionality matters. So in a medical context, and this is an example that's well known in pharmacoepidemiology, diseases occur and they're not always diagnosed immediately. So there's a disease onset. Then these diseases may cause sometimes unspecific symptoms. They may cause specific symptoms that will help to diagnose the disease, but some diseases will lead to all kinds of symptoms that are not necessarily immediately related to the condition that has emerged. And then what happened is individuals seek help, healthcare, and want to treat those symptoms, unspecific symptoms, and they get prescribed. Okay. And then after a while further, the diagnosis of this disease happens because other symptoms emerged, the disease has progressed. And now the issue that arises here is that the true causal relationship actually is really that disease is causing symptoms, and symptoms indicate or make the medication be prescribed. But what may happen in practice is that if we just look at the data, it may look like that the medication preceded the disease and therefore could be perceived as a potential cause of the disease. So that means there was an indication, and this indication is not recognized as a symptom of the disease. The indication led to the medication, and then the medication spuriously led to disease. So again, my question to all of you is would there be a way to, or is there a way to prevent such misinterpretation of data? What needs to be done in order to to learn or to understand that there's limiting, the interpretation might be wrong. And what I would think is that if the exposure of interest is medication, right? Of course, we need to understand why was this medication prescribed anyway? So that means asking this question will bring us back to the indication. If we have a conversation with experts, okay, and then the experts say, well, that medication was prescribed because of that. But now the critical part is actually from a knowledge expert view to understand, wait a minute, but this indication is actually a symptom of the disease. So that's why I made this arrow red. So this arrow here, because that was the trigger for the medication, that should be the aha moment, ideally, somehow in a participatory moment where you say, wait a minute, I mean, the whole symptom thing, it could actually be that this is not the right thing here. It's actually this way. So again, this is stuff that the machine will not know, like the algorithm, because you feed in a lot of data, and the data will only, in an associational sense, understand causation also as a temporal measure, but not taking into account unobserved variables, for instance, the onset of a disease. So it's just one example where I think there's an obligation for clinician experts and other stakeholders to get involved, even perhaps they're the patients who experience the symptoms, and to really help data scientists to make sure that they do not claim certain causal relations that are not there. And that's what this phenomenon we can see here is reverse causation. And it's very similar to the laptop and to the laptop case, because my purchase of a laptop that happened in downtown was not registered by the online website I did. So it was a latent variable that actually triggered my purchase of the laptop case. So just want to show you that causal diagrams, which I just used, are a very simple tool where we have different players in the system, and the arrows indicate causal relationships. And because they're such a simple and graphical tool, they should be used also in participatory methods. And I know there is fuzzy cognitive mapping, for instance, that uses the same concept. It's basically laying out the different phenomena of players in the system and try to connect them through input by participants, and try to get an understanding, and a subjective understanding of the mechanisms in place. And this is now a little challenge here. I want you to think about this and put it in the chat, and we can discuss in about 5 minutes. Start discussing that. So I draw a graph here. If you're on a boat, on a big ship, let's say the Titanic. The Titanic is about to sink. What are the factors that determine survival? I had argued, okay, age for sure, because children should go on a lifeboat. So if you're younger, that's protective. So age is protective. So there's an arrow from age going into survival. Sex, traditionally, and I hope still today, female passengers would be a priority. That means sex may also be a predictor of survival. And also class. If you booked a first-class ticket on a Titanic, you may have a higher chance to get on the lifeboat than if you booked third or fourth class. So now all these three variables point to survival. Now I have created another variable here that's called jewelry, which I challenge you. I mean, I would say from my point of view, jewelry has nothing to do with survival. Once the boat is sinking, no one is interested in your diamonds. However, jewelry is a function of age. If you're older, you might be more wealthy, also wearing more jewelry. Sex, perhaps, at least back in the days, Titanic times, maybe females would have been more inclined to wear more jewelry than males. And also class. Obviously, you wouldn't be able to afford jewelry if you were in a lower class. So in fact, this is a project with one of my students, Stephanie Long, where we actually show that if you introduce this meaningless variable for survival, which is called a collider, because arrows are colliding here, we will actually see the machine learning suggest that jewelry is important for survivorship, because it does not consider the absence of a causal error here. And that's the external knowledge I was talking about. External knowledge, the reasoning we all should have, no matter how much experts we are in Titanic or jewelry, we have a knowledge that can apply in this context. This is another example I want to show you. Image recognition. You will get visitors. You will have trade people knocking on your door and trying to sell you stuff. And they will sell you amazing AI technology, machine learning that can help you to predict, to forecast, to do certain tasks you have to do in your professional life. And we all know this procedure at the airport, even though it's been a while for most of us. We walk through a scanner and the scanner detects certain areas that are suspicious. Now, the same is being done in X-rays, and now a lot of X-rays are being analyzed for COVID-19, trying to predict, trying to find algorithms to predict the survivorship, course of disease of COVID-19 patients. Some of those algorithms might be advertised saying, we have a high predictive accuracy of 90%, 99%, and it's a black box basically. And there will be a research paper, you can read it, it sounds all great, and you may buy that system. Your hospital, you may buy it for yourself. I urge you, before you buy, try. That means see, have a look. And even though machine learning typically is a black box algorithm, that means it's a very complex, it can't be expressed in a single formula, there's ways to illustrate features being used in the algorithm. So feature extraction is a field, is an emerging field in machine learning. You should always demand some sort of illustration on what's going on and how prediction works. So this example here is a lung X-ray of a COVID-19 patient. So the red areas are areas that the algorithm found are supporting the claim of having the disease, and the green areas are areas that the algorithms suggest support the claim of not having the disease. So we have this balance between sensitivity and specificity. So there's a competing, the features are competing for against each other. Now, what is interesting, and I quote this here, you see actually some of those areas fall outside of the body. Because this is, we talk about COVID-19, so we're actually mostly interested in these, in the lung region. But this is very strange that the algorithm, if you look at it, if you zoom in here, draws on features outside of the body. And the authors admit that. They say, seeing as these regions are outside of the patient's body, it is obvious that it should not be consistently highlighted as contributing towards prediction. After closely reading the description of the data set, so they use the data set on a competition website, we discovered that all of its chest X-rays were taken of pediatric patients aged 1 to 5. This constitutes data leakage, as the model was likely picking up on features of adults versus pediatric X-rays. So what they basically admit here is saying like, the whole algorithm had been trained on a different set of different individuals that had a different, I guess, scale, I would say. Scaling probably matters in the prediction here because it's children X-rays, they are shorter than human. And they say, okay, the whole thing is basically bogus. So again, this is something anyone should be able to pick up. I mean, maybe not anyone, but anyone with at least a bit of understanding on what is the question we have, which is lung, and how does this algorithm apply to it, which is identifying areas that are beyond even the body. So participatory research again. At what step in this project, what could have even avoided that the competition website is using a different set of X-rays or has not been clearly articulating this issue? Okay, and I think I want to show you one more example, and then we can go into the discussion for at least 10 minutes. I just want to show you some of my research. Again, one of my PhD students has been doing, and together with another professor in our department, the visiting scholar. So we had access to survey data on patient satisfaction in China. which is great. It's a data set. It's available. It's a study run by the WHO, so the quality of the data is quite good. And we say, okay, that's an interesting challenge here. So we have patient satisfaction data, and we have a lot of other characteristics. So why don't we use machine learning to find out what drives patient satisfaction? And all what we need to know now is that we had 4 satisfaction levels: very dissatisfied, neither satisfied, not dissatisfied, satisfied, and very satisfied. But what was a bit concerning is that we had only very few cases, about 105, in the very dissatisfied category, and we had a huge amount of satisfied patients. So there was quite an imbalance in representation of populations, if you will. And then, okay, whatever, we have 5,700 data, just put it into the black box and magic happens. And then what we saw is actually when we used the whole data, that the classification performance, the accuracy in correctly classifying the satisfaction status was actually very poor across most categories, except for the most prevalent category. So the most prevalent category, satisfied, just to remind you, was 74%. For these individuals, we could perfectly predict their status. So they would probably benefit from the algorithm. However, all the other underrepresented categories were below what we would expect by chance. So imagine if you have 4 categories, chance prediction would be an accuracy rate of 25%. So that's the threshold you want to go beyond. So in the poorest performing category was the very dissatisfied, the low prevalent category. So why has that happened? Because it's a very simple thing. Again, once we understand a bit of what's going on, machine learning maximizes the overall classification error, minimizes the classification error, maximizes overall classification accuracy. Now, because there's 74% in the data set that were in the satisfied corner category, the algorithm said, oh, I'm not even bothering. I just declare almost everyone satisfied, and I'm gonna get 74% predictive accuracy. So basically brushing over these low represented groups, we achieved a great marginal classification error, which is not what we want. So in order to circumvent that, what you actually have to do is you have to make sure the data is balanced. You can do this either by weighting or by random sampling. So since the smallest category was the size of 100, the very dissatisfied group, we just sampled a sample of 100 repeatedly, excuse me, and rerun this algorithm. And what we see now is that with a random sample of 100, when each group is equally represented, we see that each group is benefiting, that actually we can predict with high accuracy, even the very dissatisfied and so forth. And we go beyond the 25%. So again, this is a very simple trick to avoid misinterpretation and flawed conclusions by making just sure someone looks at the data and understands, hey, wait, there's underrepresentation. And in fact, this problem has occurred in skin cancer studies that were predominantly sampled with Caucasian male, for instance. These algorithms have done a great job in predicting skin cancer in Caucasian males, but not in other ethnicities and other individuals with different skin tone. So this is really an issue. It doesn't require a PhD in statistics to pick that up, but we need mechanisms in place to ensure someone is looking at what's being done and what are the findings, how they differ in these groups. One of the reasons why now gender analysis, for instance, and sex and gender analysis are required by funding agencies, but we need to go beyond that to include more underrepresented populations. Okay, so I think I've advanced with the time. Final graph is this one. Trust your human reasoning, trust your intelligence, because we have outperformed machine learning by nature, if you will. The eagle eye required several million years to achieve a performance by feature selection that we now exceed in a very short time. So, I mean, human beings have been around on a short time, and with cameras, telescopes, microscopes, we've been able to see much further than eagles. So because we used our brain. Okay, having said that, I want to say thank you very much for listening, and sorry for rushing through. Time is always too short for this, but I'm happy to answer some questions now.
Thank you, Dr. Tibor, for such a wonderful presentation. I personally wish I could hear more, but time is not on our side. Okay, so we have 25 minutes for discussion. If you have any question, we recommend you posting it in the chat, but then if you prefer speaking, you can raise your hand, and then I'll pick you up and ask your question. So before then, I see two questions in the chat, so I'll just read it. There is a question from Anne, and then she asked, isn't it interpretation, not the association, that is bogus?
That's a very good point. I would say yes and no. Interpretation is one of the biggest issues. In the case of the laptop case, it's a bogus. The association is true, but the way how it is used basically in the context of suggesting or informing policy, that is bogus. And you're right. If you use association, strictly association, it's bidirectional. So there's nothing wrong in saying, people with that have ordered a laptop will be more likely to order a case. But yeah, interpretation should be the focus. Very good point. Another question here.
Another question from Samira. She asked that what are the advantages of causal reasoning over FCMS?
Now you have to explain what FCMS is, Samira.
Oh, it's a quasi-cognitive maps that you just explain a little bit about how we can get the causation from FCMs, and I wanted to know what do you think about the main differences?
Yeah, there's a couple of differences. First, fuzzy cognitive maps are not quantitative in that sense. They're really qualitative. That means the strength of the error, the weights, are induced by the stakeholders. That means they will tell the importance of the thickness of the errors, let's say. Versus in causal inference, the absence and presence of an error is still informed by experts. So that's what fuzzy cognitive mapping has in common. But the weights are determined by the data. Also, I don't think fuzzy cognitive maps are necessarily acyclic. So in real causal diagrams, you're not allowed to draw, for instance, let's say weight and depression. It can be a directional relationship. In causal diagrams, you would not be allowed to draw an error that goes both ways. You would have to introduce a time sequence. So, but there's a large overlap. But I think fuzzy cognitive mapping is one of the methods that should find entrance in data science.
Okay, so it seems things have changed, and then we have up to 1:30 for the question, so we have 6 minutes. Alexandra has a hand up, so we'll call her to ask a question.
Yeah, well, first I just want to thank you, Abdul, for doing the moderation, and thank you, Tibor, for this project. I think this is great, and it's more of a comment, but I really like the fact that you emphasize the importance of stakeholder engagement, and often we think of participatory as patient engagement, and yes, patient engagement is so necessary to understand how things happen, and non-researcher clinicians also. So this is to remind all the clinicians that your input is very important to understand and interpret data, and same for researchers. Collaborating with clinicians can really give that perspective. So I would say stakeholders, remember that it's patients, community represented, but clinicians can be so helpful also, even with the smartest biostatisticians. They need all that. So thank you so much for this reminding.
No worries. Thanks for appreciating that. Also, like Marion's comment on this, that's an open competition to find explanations why the non-smoker, there were less non-smokers back in the days, but they still had cancer rates. So secondhand smoking is an issue which is not measured or harder to measure even than smoking.
Okay. And then there is another comment that from Serge, that the confusion between association and causality is also very present among statisticians and students in statistics. This difference must also be well explained in our classes for those that teach. So I think that goes to the professors, that you really enlighten the students on the difference between association and then causality.
Yeah, and also see just Pierre's comment here. Maybe I can also briefly comment on that. He's suggested maybe panels could be employed. That means an expert panel that involves clinicians, managers, patients, and that's it. This discussion is open now. I mean, I think we all need to be part of this because I think we are the expert, not even me, but in participatory methods, and I think it's time that data science get on board, and they have an obligation. And if we do not show them what to do and how to do, they will not do it. So sure, I think we need to develop more frameworks, and depending on the situation, a panel might be okay. It might be really someone who follows along the way, the public. Many ways to think of.
Any other question? Okay, Tracy said, I really like your push to have the courage to use your reasoning, and would add, have the humility to question your conclusions. Yeah.
Very good point.
And then Vedel also said, indeed, I think qual research can inform causal diagrams. No.
It must. It must. And so this is another, it's something that really bothered me for a long time, because as a statistician, you've been trained in saying, okay, you have to make assumptions regarding the effect size, even in a very standard setting, right? When you plan a trial, what's the effect size? What's the clinical outcome? And in causal inference, even more so, they ask you, okay, you have to draw a causal diagram. But the statistician, the analyst at the end has not the knowledge to do that. Of course, there is some intuition, and some are brave to do that, or crazy maybe. But there shouldn't be even an option. It must be mandatory to have a rigorous framework available that informs those inference machineries. So yes, qualitative methods are completely needed, and we need to find a dialogue, a platform, how we can mutually learn and establish these type of frameworks. I think Anne has a
hand. Anne has a hand up. Okay, Anne, can you please go
just
ahead?
to say that I think there's quite a long way of catching up to do with this. I mean, we've had reviewers of articles describing findings from fuzzy cognitive maps and saying, but hang on, you should scrutinize this knowledge, because this is knowledge. It may be flawed, it may be biased. You should scrutinize it with the results of scientific studies. So, there's still a long way to go.
That's why we need examples, compelling cases. Let's say the Titanic example is not always good, but we need to educate. And the data science train is running fast. We have to jump on now, because and it's not jumping, we may get under it otherwise. So it's time to act. John from Ireland.
Okay, John.
Thanks. Hey, Tibor, nice to see everybody. Thanks so much for this. I'm just realizing I put two things in the chat, but I accidentally just sent them directly to Pierre instead of to everybody, so no one's seeing it. I just wanted to say thanks for this. This was really, really terrific. And I mean, I think this is things that, many of us in participatory research or in anything have long thought about, spurious causations and even inferences that don't really mean anything, and the direction being wrong. But about machine learning, it's so important to hear this about machine learning, because we're starting to get this idea in society that machine learning is almost infallible. And, and it's permeate. I mean, the examples you gave with, with interpreting X-rays and things we hear about pigeons being able to outperform oncologists, and then the TSA things. It's so important that we have proper humans with knowledge of the context trying to interpret what's really going on. And I mean, we had something very similar, 25 years ago with the Ganawagi data, that we had a control, I mean, it wasn't machine learning, but we had a control community. And 1 year in the longitudinal study, the control community just suddenly got much more fit than the experimental community. And all the data was right, and all the math was right. The statistics were done properly using the proper things. But, but the stats can't understand what the teachers knew, is that, word went through the community that, hey, these researchers can't make us run if we don't want to. So none of the kids in the experimental community ran 1 year. They just didn't try. But the researchers doing the data back in the university had no way to know this without bringing it back to the people in the community. And these are exactly the types of lessons that we can never forget. So really, thanks.
Thank you very much. It seems time is up. So the next seminar will be on October 8th, and it will be presented by the PBRN. More information on that will be sent. And then once again, we thank each and everyone for taking time out of their busy schedule to attend this seminar. And then a very big thanks to Dr. Tibor for this wonderful presentation. And then a very big thanks to the organizers as well. We really appreciate your work. Thank you, everyone. And then see you on October 8th. Bye.
Thank you, Abdul. Thank you, everyone.
Thank you, Tibor.